Hi, my name is Israel Maurath and I'm going to talk about disorder of fluid and electrolytes, maintenance intravenous fluid in acutely ill patients. Definition: a critical aspect of the care of acutely ill patients is the administration of intravenous fluid. Intravenous fluids may be required as a bolus infusion for resuscitation or as a continuous infusion when sufficient fluids cannot be ingested orally.
Prime in the bag. Got your bag, make sure you've checked your orders and all that stuff that you do at the beginning, your expiration date and everything. Your primary set, you need to know how many drips that you've got on, how many drops you've got per milliliter. This is a 10 set. Your primary extension set is going to be a longer set. Should have numerous ports on it. You'll have a roller clamp. In facilities, they'll look a little bit different because they'll be designed to handle the pumps. This drip chamber right here is very important. Just a minute. You're going to keep everything sterile. This is your spike. You take your bag. This is your medicine port. Pop the top of that off. Throw it at whoever's standing next to you. Goes in, make sure it's secure, and flip your bag back up. You're going to squeeze that chamber until it's about halfway up. You can go on and hang your bag. What you're doing is you're letting the fluids come all the way through it. You do not have to take the cap off. See, the fluids will drop through with just the cap right there. I'm not going to get it all over the floor. One thing that you might want to do if you see you're getting a lot of air bubbles, if you'll turn the tubing upside down and flick on it like that, see how many more air bubbles come out of it, and start going down. So we're making believe I've got that hung over something. You can see the air bubbles coming down. Again, flip it up. If you flick on this, you're going to see more air bubbles are going to come out of it because it's holding a little bit of air. Get all your air out of it. Once the air's out, it's dripping. Take your roller clamp, clamp it down, and you have primed your primary tubing.
Application in medicine. We can use this therapy in the following cases: hypernatremia, volume replacement, hypovolemic shock, hypertonic dehydration, tract maintenance, energy input, hyponatremia, and hemorrhagic shock.
Normal saline is a commonly used isotonic intravenous crystalloid fluid. Although it was created to approximate the same osmolarity as human plasma, normal saline contains higher sodium and chloride concentrations than plasma, and its infusion can lead to hyperchloremic metabolic acidosis and kidney injury. Balanced crystalloid solutions, such as lactated ringers and plasma light A, have more physiologic electrolyte concentrations, and thus may have less negative impact on acutely ill patients. In the single-center pragmatic unblinded SALT-ED trial, investigators tested whether the composition of crystalloids affected outcomes in non-critically ill patients. Over 16 months, the trial enrolled 13,347 adults who received 500 milliliters or more of isotonic crystalloids in the emergency department and were subsequently hospitalized, but not in an ICU. In alternate months, participants were assigned to receive either balanced crystalloids or saline. The median crystalloid volume received was 1,079 milliliters, and 88.3% of patients received only the assigned fluid. The primary outcome of hospital-free days, defined as days alive after discharge before day 28, was the same in the balanced crystalloids group and the saline group, 25 days versus 25 days. Patients in the balanced crystalloids group had a lower incidence of the secondary outcome of major adverse kidney events within 30 days, which was a composite of death, renal replacement therapy, and persistent renal dysfunction, 4.7% versus 5.6%. A concurrent study performed among critically ill patients also showed a reduction in major adverse kidney events within 30 days. 14.3% with balanced crystalloids versus 15.4% with saline. The authors conclude that among non-critically ill adults, balanced crystalloids and saline resulted in no difference in hospital-free days. Full trial results are available at nejm.org.
Pros and cons. Pros. They are fast-acting because they do not need to cross the first step phenomenon. Many presentations for different pathologies. Cons: aggressive hydration with crystalloid solutions such as 0.9% saline can worsen intestinal edema and lung functions. Application in Ecuador. In Ecuador, maintenance intravenous fluids are used to provide critical supportive care for children who are actually ill. Intravenous FS are required if insufficient fluid cannot be provided by using internal administration for reasons such as gastrointestinal illness, respiratory compromises, neurologic impairment, and perorative state, or being moribund from acute or chronic illness. Conclusion: many adult hospital inpatients need intravenous fluid therapy to prevent or correct problems with their fluid and/or electrolyte status, descending of the optimal amount and composition of intravenous fluids to be administered, and the best rate at which to give them can be a difficult and complex task, and decision must be based on careful assessment of the patient individual needs.